you say oral surgeon to someone, people think
Wisdom
teeth, right?
Yeah.
You can make cuts in the jaw and move it anywhere you want. Bro, I had a lady come in. She had this thing growing out of her forehead. I was like, lady, you have a foreign object there. I mean, I can feel it.
Craziest thing that anybody's ever asked of you.
Bro, I had people ask me for testosterone, dude.
Can testosterone make me taller or no?
No. It can make your bigger, though, so maybe that's better. Cholesterol's a good thing, dude. Like, we need cholesterol. For all our hormones.
Yeah.
What's your perspective on nicotine?
There are some good nootropic side effects of it, and I think it's great. Dude, there's nothing generic about fentanyl, by the way.
It doesn't last that long, actually. It's actually a very short-acting opioid.
Yeah, the last thing I want is my doctor to be like, oh, man, just got a great pump. I could barely lift my arms. You ready to go under the knife?
But they do know.
We are live. It's Close the Door Behind You. We have special guests in studio tonight. We have Dr. Manolis. Welcome, sir.
Thank you very much, Dr. Jud.
As usual, I'm Doc Jud, and we have ChrisTos with us today. So what's been up, Dr. Manolis?
Man, just
Manakakis.
I got a Greek making fun of a Greek name. That's perfect.
Yeah, but you're one of those Greeks where they didn't have any fucking idea what to name you, so they just took your last name and made your first name.
You're right. Yeah, and they named me after like Streptococcus, Manolis Streptococcus. Yeah.
What's the story with Greece and like there's like the land people and the island people, and they've got like they got issues with each other?
Well, the island people have lower IQs.
Right. Yeah. We have better beaches though, so that's all that really matters. You have a beach where your parents?
Yeah, dude, I'm on the Peloponnese.
Is that what you call that? A beach?
Yeah,
I
dude.
don't remember.
It's a
being
great beach.
So you're from the land side then? You're
Yeah,
not from
I'm from
you're not an
mainland.
island
He's
person.
mainland.
Yeah.
He's sophisticated.
I'm literally where all the innovation and things you attribute Greece to are from.
Right.
So what are the island people are just like super like
So
simple
all the people that
and
visit
chill?
Greece go to the islands. They don't go
Got
where
it.
he's from.
That's where you get robbed where he's from,
Correct.
right?
Right.
That's where they
It's
like blow up
inner
your
city.
car.
I would rob
It's
you.
inner city.
Have you been back to Greece lately?
Yeah, I went not this past year, the year before.
So do you have like family there still and
Yeah, I
like
got,
property and stuff like
Property, I got family, I got cousins, aunts, uncles.
Oh, that's so cool,
yeah,
man.
It's great.
that? I got to go with let's all go.
Yeah.
Let's have a Close the Door Behind You special trip.
Greek
2026 Greek retreat.
Yeah, I like
That's
that.
nice.
That's a
That'd
good
be
idea.
awesome, man. Like what is there to do in Greece? I mean, you can sit on the beach and get tan. What else?
Yeah, I mean, that's obviously you can go to the beaches and stuff like that. I mean, the food is unreal.
Yeah.
There's a lot of history. I mean, you can go to the Acropolis in Athens, and there's just so many other like things that you can see. The first Olympic Stadium was there. I mean, there's a ton of history in that regards, and it really is just a cool vibe, man. It's people are this whole like mentality of like relaxation, and they don't stress like we stress here.
No.
They have a completely different outlook on
Almost
life.
to a fault.
No, I mean, listen, they could sit at a Cafe Neo, which is a cafe,
Yeah.
for hours sipping on a small little frappe, which is, a snappy thrappy. It's basically like it's coffee, whipped milk, a little bit of sugar.
But on a weekday?
Every day.
Every day.
Every day.
For several hours.
And play backgammon
Yeah.
for hours while playing their kumboloi, which
Yeah.
is their like little worry beads.
Yeah.
And they live a great life, dude.
So how is it that
They
okay?
don't pay
So
their taxes, but that's a
Yeah.
whole other like,
Yeah.
So
and
how
they're
is-
talking shit
Right.
about everyone they
Everyone.
know
Right.
during that
Right.
game of
Right.
backgammon.
And there's no women there.
Yeah.
Only men.
Yeah.
meaning
it's
at
meant.
the there's no women in Greece?
No,
There's no women
tons
at
of
the
in
table.
Greece.
Yeah.
There's
Oh.
no women at that scene.
Yeah,
Oh, I
that's like a
gotcha.
guy's
That's a
thing.
guy thing.
I mean, it's
Okay.
kind of gay, but it's still. Yeah.
What do the women do?
They're at home cooking.
Oh man,
Yeah.
sounds like a
Dude, a lot of
Magical
my
place.
aunts, like their
I had it all
entire
wrong.
life is like, what am I gonna make for dinner? What am I gonna make for lunch? And then once lunch is done, they're like, what am I gonna make for dinner? It's awesome.
It's
but the
very
people
food oriented.
Yeah.
but the people who moved from Greece to like Monmouth County, Jersey,
Yeah.
who I knew, they're like very industrious people. They're
Well, yeah,
like
all the ones that left Greece are like for the most part, the hardworking ones.
got it. All right. So that makes sense.
But Greece is building up its like economic branches now. Like they're like
has
tech.
changed, yeah.
Yeah, tech is kind of booming there now. They are trying to make it like a power.
Well, by the way, shout out to our sponsor, Izakaya Juraku. If you're ever in Manhattan and you're in the Lower East Side, stop by Izakaya Juraku. What an izakaya is, it's like a little Japanese bar where you can kind of hang out and get some drinks, get some sake, got some, little food. It's super cool. So when you come swing by Izakaya Juraku. Have you ever been to an izakaya in? Have you been to Japan?
I went to an izakaya in Japan, in
Oh,
Kyoto,
cool.
man. It was unreal.
Yeah.
We had a great night. The bartender was fabulous. She must have been like 85, 90.
Yeah.
And just whipping up shots of sake. And
Well,
we
our
met some
buddy
Australians.
Keo,
We met some Australians. We closed the place down with the Australians, and we actually kept in touch with them, like pen pals from the internet and stuff.
I gotta say, this is one of the only izakayas in New York that has kind of that vibe,
Yeah.
but it does have like a kind of eclectic American
Yeah.
twist to it. But they also provided us with Asahi beers.
great
So
beer.
do you want one?
Absolutely.
You want non-alcoholic or alcoholic?
What's non-alcoholic?
This one's non-alcoholic.
Nah, I'm good, man.
Yeah,
I'll take,
we
I'll
just
take
have
some
that.
alcohol.
A lot of comedians
Enjoy.
are, they
Oh,
lack
really? They like to-
self-control, and
Yeah,
so they.
I'm definitely not funny, so
Yeah.
I don't fall into that category.
What does "not from Paris, madam" mean?
It's a brand.
Oh, okay,
Yeah.
that's kind of cool. Yeah, it's very rock and roll.
Yeah.
He's very rock and roll. Dude, you're wearing like actually, you know what's funny? You normally wear a lot more jewelry.
Yeah,
When I
you
see
know
you.
what? I didn't have. I'm usually all.
And
blinged
he
up.
actually so ChrisTos always is like
Yeah.
wearing a ton of jewelry as well.
I have nothing. Like, so my one ring from working out bent, so it was digging into my finger.
Oh.
and
dude, that's
then,
dangerous.
Yeah, I was not happy.
His wife actually is a jewelry designer and makes him all these crazy things.
Oh,
He's
that's
got like a
great.
million rings all the
Yeah.
time, but it's similar to like
Yeah,
you've
then
got like,
my big chunky ring that I wear, I forgot to put it on today, dude.
usually have I don't know what it is, man. I just like don't feel it's not that I don't think jewelry's cool. It's like whenever I put jewelry on, I just never like anything.
Yeah.
And then I'll finally like buy something and I'll never wear it and I'm like, that was so stupid. Like I don't even wear a watch.
Yeah, that I don't do. I don't wear a watch. I gave all my watches to my wife, Margarita, dude. She
She wears 'em?
Dude, they look so much better on her, by the way, than me.
Yeah.
And she rocks it. But I stopped wearing a watch.
Dude, I broke my wrist snowboarding
Yeah.
when I was like in residency,
Mhm.
and I had to have a surgery. I had to it was bad. I like broke I transcaphoid perilunate dislocation, so that meant I like tore all the ligaments.
Yeah.
So they had to fire like a bunch of pin. They put a screw in my scaphoid, fired 3 pins in there, and I was in a cast for 3. Like normally you're in a cast for like 4 to 6 weeks.
Right.
I was in a cast for 3 months.
Damn.
And so it just gave me such an aversion to having something around my wrist that when I took it off and I tried to put a wristwatch back on, it like gave me like the like heebie-jeebies.
Yeah.
And so I can't to this day wear a watch on this left hand. It just like freaks me out.
Yeah, I don't know the watch thing. I like them, but every time and then I would, from working and washing my hands all the time. If I'm in surgery, basically I would get like a rash around my wrist.
Yeah.
And I was like, this sucks.
Right,
So I
yeah.
just gave it up and just.
Yeah, that makes sense.
And the freaking phone, man, has the watch on it, so I can.
So you're doing are you doing surgeries in New York City as well as,
Yeah.
as down in Jersey?
Yeah. So, pretty much I do everything that I do in Jersey, I can do here in New York as far as like procedure wise.
Okay.
And I operate 99% of the time out of my office.
Tell the
Both
viewers like
places.
what is it that you do? You're a plastic surgeon,
Right.
but what is
so
you
it's kind of complicated, and it's
Okay.
it's kind of an interesting path I took. So, as you know, I went to dental school. But the reason I went to dental school is because I wanted to become an oral and maxillofacial surgeon. There was a guy in our town who I was working for, and I was like, wow, man, this is really cool. I'd watch him do some surgeries in his office, little things like bone grafts and dental implants. And then one day he took me to the hospital, and he's like, I got a great surgery to show you. I was like, all right, well, what is it? It's called orthognathic surgery or corrective jaw surgery. So like, what are you going to do? He's like, well, I'm going to make a cut inside the guy's upper jaw. I'm going to make a couple cuts in his lower jaw. I'm going to move the bones around, and I'm going to put plates and screws to put everything right back into the right spot. And I was like, bullshit. No, you're not. And he was like, yeah, I am. And I'm like, okay, well, let me see it. And that was it, man. Once I saw that, I was like, that's exactly what it is I want to do. I wanted to do something that was with my hands. I didn't know what I wanted to do. But once I saw this stuff, I was like, all right, this is.
you weren't even sure that you wanted to be a doctor.
that's a funny story. Yes, I kind of knew I wanted to do that. I just didn't know what the fuck I wanted to do. So,
Okay.
and in reality, dude, I was like an average. I'm more of a hard worker than I was a great test taker or
Got
a
it.
great student. I was average, but I put the time in. So,
Yeah, I'm
so,
similar.
My dad, God rest his soul, when I was 19, and at the beach in the summer, dude, you just do nothing other than drink, party, and hang out at the beach.
Right.
One day he came in Monday morning, dude. It was my fucking grades came in from school. He's like, that's what I'm paying for you to get
Oh,
average.
you had bad grades.
Yeah, they
Oh,
were
just average. B's.
They weren't bad. They were just average, dude.
And so your dad was a pharmacist.
So my dad was a pharmacist.
He owned the pharmacy in town.
and he was
yeah.
very close with your dad.
Yeah.
I could call them like the pillars of the community.
For
dude.
sure.
Like, they
yeah.
were just
They had
really
my dad had
super
the utmost
great
respect
guys.
for your
Your
dad.
dad
yeah.
was awesome. And, it was just, so he comes in one morning, he rips off the covers. He's like, you think you're going to go to medical school? And I'm thinking, well, fuck, he got my grades.
Yeah.
And I'm like, you know what? I'm going to become an oral surgeon. I had no idea what that meant.
Yeah.
I didn't know what I had to do.
Right.
Something just came into my...
But you were working for
Not
an oral
yet.
surgeon?
Not
oh,
yet.
Okay.
So he's like, oh, okay. He's like, your sister Marika has a neighbor who's an oral surgeon.
Okay.
Mark Weil. I was like, okay. And she's like, hold on. He calls Marika. Marika's like, let me call Simi's his wife. Let me call Simi. They get back. She calls Mark. Marika calls my dad back. He's starting surgery in 10 minutes. Get your ass over there.
Wow.
And that was it, dude. I got into this, and I'm like, what am I doing here, dude? I'm like, I don't even know what happened. I was in my bed 15 minutes ago.
Right. Wow.
And then from there, it just snowballed, dude. And so I got into dental school with the notion of I wanted to go and do maxillofacial surgery.
Right.
When I was in residency, we were doing gunshot wounds. We were doing jaw surgery. We were doing head and neck cancer stuff. We were doing all sorts of, like, wild things that when you say oral surgeon to someone, people think
Wisdom
teeth, right?
Yeah.
It's like standard.
Right.
But the training of the oral max surgeon is very robust, and it's become more robust. So while I'm there, I get bit by this cosmetic bug.
Sure.
And I'm like, well, we can do trauma patients. I can do Lafort 3s, cranial, cut downs, put the pieces back together, and they look somewhat normal.
Right.
I'm like, if I can do it in that situation,
Right.
I should be able to do it in an elective situation.
Sure.
So I said, fuck it, let me go do a fellowship. So I went and did a fellowship.
Cool.
And my practice is probably like 90% cosmetic at this point.
Yeah, that makes sense. So when you're doing cosmetic stuff, meaning what, like nose jobs and facelifts, or what does that mean?
Rhinoplasties.
Okay.
So there's a bunch of stuff. There's like non-surgical, which are all the injections, whether it's Botox, Jeuveau, fillers, chemical peels, lasers, and then there's the surgical stuff, which is facelifts, rhinoplasties or nose jobs, blepharoplasties or eyelid lifts, brow lifts, ear tucks. All sorts of like lip, like really cool.
Do you do
stuff.
anything below the neck,
No,
like
I'm
boob jobs or
strictly-
anything like that?
I'm strictly here, man. That's
Okay,
it, man.
okay.
That's it.
But theoretically, you could.
I can take if I need to graft. I'm allowed to come down.
Oh, you can take like fatty tissue out of
I
like
can
the abdomen.
So I do a lot of fat grafting.
Okay.
So I'll do like lipo, not for contouring, but for just grafting purposes.
Donation. Okay. Interesting.
Yeah.
Wow. What do you think about this new? Did you hear? So I spoke with a gentleman by the name of Dr. Albert, who is. He is an expert in stem cells and PRP. He actually wrote one of the books, and I just had lunch with him last week. He told me that he co-wrote the bill in Florida so that stem cell manipulation is going to be now available in Florida, whereas in the past it's not been. So you could actually use like embryological or amniotic fluid lines and stuff like that. So did you hear about that?
I didn't hear about that, but I'm all for it.
So just as of July 1st of 2025, this is like the new thing. And so so in Florida, we're going to be able to do that kind of stuff.
great.
I think Utah as well, ironically, which is like a typically very conservative place.
Yeah.
I guess they're both
They're
conservative.
very conservative.
But anyway, so I don't know. There's probably going to be some opportunity. It'll just be interesting to watch because I think we've been. Listen, I mean, I could understand some of the argument is made like it's a slippery slope, but like if they're not taking ground up babies, they're taking placental tissue after the baby's been born. There's something called a placenta that gets delivered afterwards. You can then take amniotic fluid. You could take all types of cells from the cord, and you could use them to basically grow cartilage in people's joints, and maybe even like there might be applications in plastic surgery where
I use stuff like that.
Oh, you do? Like what?
I had my shoulder and I had a slap tear.
Yeah.
My labrum was torn. I had a slap tear, and instead of having surgery, I had my brother-in-law shoot me up with amniotic fluid. And I swear to God, I don't have for 8-9 years now. I have not.
You haven't had a problem.
Seriously?
Did you get
how
did you-
fast
I
did it
couldn't,
kick in?
dude. I couldn't pour milk.
Did you get a? So let me ask you a question. So clinically,
pouring milk
clinically is
like
all
that?
clinically all that's all that matters, right? Is that now it's approved? But did you ever get an MRI to see if it repaired itself?
So the MRI hurt so bad because I had to do with contrast.
Intra-articular contrast.
I had to do intra-articular contrast. That hurt more than the actual anything I did, or even the injury itself. So I never went back to do an intra-articular injection again. I was like, why am I even?
Right.
But there's no way that it's not healed.
So
It
when
can't be.
when you were gone, he was saying all the different things he does. He does a lot of like jaw surgery. So when you talked about breaking people's jaws, putting them together, I have a huge jaw. Like I look like a
Disgusting.
barracuda.
Yeah, I don't know how you got past me, dude. I would have.
What about me? Can you help me look
Nah,
more
dude,
masculine?
you're hopeless, dude. There's just no fucking way. to
Maybe
help
some
you.
Botox and fillers for him.
Yeah.
So what would they do?
You're
so
beautiful, dude.
Thanks,
I'm
dude.
just fucking with you.
That's the Greek.
Yeah.
what would you do with this? For everybody, take a look at the camera.
Disgusting.
I look like a Italian who mated with a barracuda and had a bar mitzvah.
So
what could you do with this?
Bro, I would leave that jaw alone. And
Why is
listen,
that?
Because I love strong jaws.
Okay.
Very important to have a strong jaw in life, right?
Right.
It commands power. It commands attention.
Right.
If you have someone who has a really weak jaw,
Yeah.
you look at them and like, dude, what's up here? Like,
Interesting.
something's wrong.
Do I have a weak jaw?
So, no, you don't. You have
Okay.
a strong jaw.
Strong jaw. Thank you.
But what I would do with you is I would bring the upper jaw out.
You can do that?
Yeah.
How is this mobile?
And then you fill out. That would fill out your. Well, you have to cut it. You have to cut the jaw.
Oh, okay.
So you bring the upper jaw out to meet the lower jaw, and then your profile becomes even more powerful.
Wow. I didn't think you
So
could
I
do
wouldn't
that.
push this back because then you have issues of breathing. You can get more sleep apnea.
But you're saying so when you say the jaw, you mean
So
this.
lower jaw.
Lower jaw.
lower jaw, strong.
You said you
have a
bring
strong
it
lower-
out?
You can move. You can make cuts in the jaw and move it anywhere you want.
Okay.
Back,
You wouldn't move
up.
it back. You'd move it forward. You said.
I would leave your lower jaw
He's
alone.
saying the top jaw
I
you
would
move
cut
forward.
the upper jaw.
Meaning that the kind that goes into the
maxilla.
TMG. Oh, the maxilla,
maxilla.
up here.
Right, I
Oh, we
would
didn't
go
even
right
know
up-
that this is part
yeah.
of the jaw, the
Right,
maxilla.
so I would
thought
cut the
this is
maxilla.
Yeah.
Right. Well, jaw. We have technically two jaws, but yes, the
the maxilla is your cheekbones,
maxilla
basically.
maxilla is the upper teeth.
Okay.
The bone.
Yes.
And right underneath the zygomas.
And you bring it forward.
You
Wow.
cut right underneath all that. You bring it forward.
Yeah.
Fills out your mid face.
Yeah. What's the
Solid, dude.
problem with
Why
like
don't
having,
you do this?
Because it sounds very
It's
painful.
fucking painful.
Yeah.
I mean, it's painful for a 50-year-old. How
Yeah.
old are you now?
51.
51.
Yeah.
I wouldn't recommend it for a 51. Unless you were having like major sleep apnea stuff where you were having really bad sleep apnea. That's a 100%.
That
actually,
helps?
98%, 92%
I do have
success
that.
rate
I do have that.
with that.
Really? No
Yeah.
kidding.
Yeah.
Wow. They tried. They
Like
did the
you know,
test.
U triple Ps and all that stuff have shown to like just not work at all.
What's a triple P?
U triple P is a uvulopalatoplasty where they cut the palate off.
Oh, yeah.
For the snoring.
Yeah.
It
doesn't work.
Not
Interesting.
Really. So the upper jaw, lower jaw. Some people have like really retracted or retruded jaws.
Yeah.
And you bring them forward. You bring both upper, lower jaw, and chin. You cut the chin, bring it all forward. It opens up the posterior airway, where you're snoring.
Yeah.
And the tongue falls back and obstructs your.
Let me ask you honestly, like, so for example, like in
You understand what? Am I saying
Yeah,
too
totally.
technical,
Yeah.
dude, or no?
No, you
All right,
sound
yeah.
totally
when we talk
fine.
about like spine surgery, for example, a lot of people will get spine surgery, especially when they've been in an accident because they think they're getting more money, et cetera,
Yeah.
et cetera. And a lot of times they have complications secondary to those fusions and such.
Right.
And it's like, oh, you should have never gotten it. Are there a lot of patients that go through these major maxillofacial surgeries and they're like, they have like really bad outcomes?
So there are, every surgery has risk, right? So there's
Yeah.
potential bad outcomes with all of it.
Yeah.
Typically, this is a surgery that's done on late teens, early 20s. That's like the best time to do this.
Okay.
The facial bones are done growing. You know, if there's a asymmetry or if there's some sort of malocclusion where the teeth are not coming correctly. So that's the ultimate time. You wait later, surgery's tougher. The complications become more real, like numbness in your lip and your chin. That stuff becomes more real as you get older.
Yeah.
But for the most part, it's healthy. You can have obviously you can have like a an osteo where the bone gets infected. You can get stuff like that.
Okay.
And it's a long surgery. It's like
Sure. Well, I mean, as
6
long
hours.
as like there's not a lot of comorbidities,
Right. I mean,
you're gonna be okay.
usually the kids are healthy when we're doing this.
Right. Yeah. So, but you're saying, and I'm like,
But
like
a
when we
sleep
talk about
apnea patient, like someone who's like in their 60s,
Morbidly obese with
morbidly
diabetes,
obese,
yeah.
right. That's
gonna probably have some
You're
problems.
dealing with a bunch of shit.
Gotcha.
So you ever see those like ads for like the ball gag that like works your jaw out or whatever? Bullshit or real?
So that's interesting. Well, the ball gag, the chewy thing, right? So it will create volume for your jaw, for your masseter muscle, because it's like chewing gum, right? You keep chewing gum, your masseter muscles and your temporalis muscles they'll bulk up, and that's good if you want to kind of get like the jawline filled. But it's not going to do shit for underneath the neck. It's not going to like tighten the neck muscles up. It doesn't do that stuff. I mean,
what do you do for TMJ people with chronic TMJ? It's like
temporomandibular joint issues. I don't do a lot of it, but there are many different things that you can. So a lot of them really just suffer from muscle spasms.
Right.
So it's either trigger point injections with Botox, whether it's temporalis, masseters, even the pterygoid muscles, are special little muscles that help move the jaw left and right. Headaches and all that stuff. That's all kind of related. But if you have a real true like joint issue, then there's arthroscopy. There's
that means you go into the joint. And,
you go and clean up whatever scar tissue there is.
Yeah.
If the disc, it's just kind of like the knee, right? The joint, the TMJ has a disc in between the two articulating surfaces. So you have the cranium, you have the condylar head, and then you have this little disc that goes with the movement of the jaw. If that's all ratty, pretty much take that are And then there's also implants. Like they do temporomandibular joint implants, which are they chop off the bad part and they put in,
and it works.
Yeah, it's tough.
I once had a girlfriend.
Now, but...
So I had a girlfriend that was having trouble giving me blowjobs. So we did everything. So I was doing like trigger point injections into her masseter. Right. Then I started doing Botox into her masseter. Thank God I was a doctor. It worked.
The lengths men would take to get a good blowjob.
I mean, listen, dude.
We have a caller, right? We have several callers, I think.
Oh, we do? Oh, cool, awesome.
They hung up. I'll tell them to call back.
Okay.
Oh shit.
Yeah, just let us know when they're on the line. Thanks. But yeah, no, that's pretty cool. So I
mean, that came in handy, huh? Having the doctor skills there.
Yeah. I mean, I was in residency.
That's why
I
say
access.
doctors get laid,
Yeah, amongst other things, I guess.
So you and Doc Jud, like you guys were created in the same like facility, like with the Adidas, the stockiness, like
Pretty much.
Yeah.
Everybody in our
I have a
hometown
caller
looks
if
like
you
us.
wanna-
We got a caller on.
Okay.
Okay, cool, awesome. Can we hear through? Through there?
We can hear her.
All right. Hey, caller,
Call
bring it on through. I'm Dr. Judd. Welcome to Closed Door Behind You. You have a question?
To accept, press 1. To send
Okay,
a
they're
voicemail,
on the line.
Press 2.
Uh-oh. We got a drop
me a sec.
caller. We dropped the caller. It happens from time to time.
They'll come back.
What were we talking about? We were talking about, where we're from. Yeah, so where we're from, we all look like this.
That's good.
Yeah.
The Jersey
I feel like
Shore.
I would feel
We're
at
fist
home
pumpers.
there.
Huh?
Yeah, I feel like I would feel
You gotta
at
come
home there.
visit.
Yeah.
You'd fit in.
Yeah.
You'd fit
Thanks, dude.
Yeah.
I'm trying to fit in somewhere.
We've got a lot of Greek people down there.
Yeah.
We got a whole Greek church and a whole...
A lot of them migrated from Astoria to New Jersey.
I don't blame them.
Are you from Astoria?
No.
Where do you
but
live?
I'm from Westchester,
Oh,
but I
nice.
live in Queens. Yeah.
Alright.
But,
There's some Greeks in Westchester.
yeah, there's plenty. We
Yeah.
have like two big churches over there. Yeah. Ernie Anastas goes to my church.
I have a
So,
caller when you're ready.
Funny you say that. Ernie Anastas his wife was his wife's dad. So his father-in-law was one of my priests growing up.
Oh,
so
holy
every
cow.
Easter we would see Ernie Anastas
Yeah.
at the church.
He's the
Nice.
man, dude.
Yeah, he was a
Hell
cool dude.
Back in Ocean Township?
And
All right, we got a
literally
caller.
back in Asbury at the time.
Oh,
Caller.
cool.
Yeah.
We got a caller. All right. Put him through, Nat.
Hey,
Hey, welcome, caller,
Hey.
to the Close the Door Behind You podcast. We've got Dr. Manolis, who's a plastic surgeon, and myself, Doc Jud. I'm an emergency physician. You got a question?
yeah, I got a question for the plastic surgeon. So my girlfriend, I like her. I love her, but she's a little small, and I want to get implants. I want to get those big the nice big titties, the ones we all like, boys, right? You know what I'm talking about.
Mm-hmm.
Yeah.
And she's a little hesitant, and but like she's kind of worried about the recovery. And I said, baby, recovery, like that's so simple now. And so I guess I'm thinking, like, what can I say to kind of ease her mind about it? Because I don't know if I long term could be with a lady that's just like this small.
So the question
What was
is.
the question?
So the question is, his girlfriend is considering getting a breast augmentation, meaning breast implants, and she's a little bit concerned about it, and he wants to figure out how he can ease her concerns about getting this breast augmentation surgery.
All right, that's a good question. I'm definitely not a breast augmentation doctor. I do facial surgery alone, but I can give you, kind of my point of view on things like this. Obviously, it's her body, dude. she has to make the decision, and the concerns are real.
What could go wrong?
I mean, just anytime you put in, some sort of implant or foreign body into your body, you can have rejection. Particularly with implants, if they're not done in a very correct way, they can have asymmetries. They can have capsular contraction, which, by the way, I am not the specialist of the breast, but these are just things I know from seeing my patients coming in, telling me the things that they've had happen. And
what if they go down to like South America? Is it better if they go to South America and save money on it?
Nah, man. There's nothing. Listen, for vacation they can go to South America, but I wouldn't do those.
Do you ever have that, like where you have
I've
patients who
had.
have had like facelifts
Oh
in
my
like
God,
another
dude.
country and they come in and they want you to fix them?
Bro, I had a lady come in. She had this thing growing out of her forehead, and I'm like, what'd you have done? She's like, well, I went to this guy, and her husband was a plastic surgeon, and
What?
that had passed away.
Okay.
So she went to South America. She's like, I had whatever done, and they put silicone sheets into my crease so that it would like relax to build collagen to take care of the crease. And I'm like, okay. She's like, but they took it out. So they put it in to create the stimulation of the collagen,
Okay.
and then they pull it out. This dude didn't pull it out. So I was like, lady, you have a foreign object there. I mean, I can feel it.
Yeah.
She's like, no, it's gone. I'm like, all right. I'm like, sure enough. So we make a cut, and I have photos of it peeling out the silicone sheets.
Oh
from
my
the
God.
forehead.
Unbelievable.
So silicone is great. It works. It's doable. As far as your girlfriend goes, man, I don't know, man. That's a discussion that you guys have. I can't help you, man.
I mean, I didn't realize you're a face expert. I mean, I guess when it comes to the face, I'm very into the facials. I like to, like ejaculate on the face. Is that good for the skin?
It's actually really good. It has high protein content, and there's this stuff that came out of Korea from salmon sperm that they've been using for facial rejuvenation.
Really?
I swear to
Oh,
God, dude.
damn.
Yeah.
Have you ever had somebody like this caller call and be like, my girlfriend's white and I'm into Asian girls. Can you make her look Asian?
Oh man, I've gotten some interesting requests. I've had people who wanted to really change their look. It's just not. It's not
hung
my
up.
thing.
That's
dude.
okay. We lost him.
Yeah.
But
They
I think
don't
you
like
answered
when
their
you don't
question.
talk
I'm here.
to
Yeah.
them.
No,
Oh,
that's
there he
someone
is.
else
Yeah,
on
I'm
the.
here. I want to know something because I'm like, how far can you take it? Like, can you slant their vagina?
Can you what?
Slant their pussy. Can you slant it to the side of her like those Oriental ladies I like?
Well, that's kind of fucked up because I don't know if Asian women have a slanted vagina.
Can
quite
confirm
honestly.
they do not.
Yeah, all right, there you go.
Yeah.
So I don't.
I thought all vaginas are slanted, just vertically.
True.
That is
True.
true.
There's an
Yeah.
angle to that. There's definitely an angle to that. So,
But
yeah.
I like, man. If you could take a white girl and then make a Korean, oh my God, you make a lot of money.
Bro, maybe you're just dating the wrong girl.
I disagree.
There are big tittied Koreans out there,
There are?
I'm
yeah.
sure.
Yeah, absolutely.
Yeah, where do you find them?
In Korea.
North or south?
North.
Definitely
You
north,
can't
dude.
go south. Yeah, you want the ones that have nowhere to go. Like, you're going to save them.
They're trapped.
Yeah, they're trapped. Exactly.
I
So-
like your thinking. I like this. I like this. You guys are on point. You know what you're talking about.
Nat, did you say we have another caller as well?
Yeah, I had to hang up on them
Oh.
to keep this one, but I'll call them back.
All right. Did we cover everything you need, caller?
Yeah, I mean, that cum thing is fantastic. I've been saying that, thinking it for years, but not having any factual information to back it up. Now that the doctor said it,
You got it,
I'm,
man.
I'm going to have some fun.
I'm so happy I could help.
Yeah, my advice is bottle it. You know,
Yeah, there
don't
you
waste
go.
any
Yeah,
of it in tissues or anything. Just
right.
bottle it
Yeah,
and
yeah.
offer it for the nightly routine.
All right, thank
Maybe
you,
put
caller.
Save me money,
maybe
guys.
put it,
Save me
maybe
money
put
on
it in
skincare.
a spray bottle for her.
Yeah, spray bottle's good.
Yeah, I'll sell it at Walgreens.
Oh no.
All right, thanks, caller. Okay.
So we get some interesting people, obviously, that
I love
call
it.
in.
I love it.
Yeah. So we were talking about.
We have another caller on the line?
I have
He
to call
seemed
them
ve-
back.
He seemed very informed, by the way. It was-
Yeah.
Yeah, he
he's-
was
he's
up to
good.
date. Yeah, it was good.
He did his
yeah,
research
he did his
before
research,
he
dude.
convinced.
Yeah,
We
absolutely.
never have normal questions,
yeah.
obviously. It's always these obscure ones. So I
course.
hope that you're not offended, Dr. Monolokakis.
Please, dude.
All right, we got somebody else on standby waiting.
Yeah.
So you're spending like half. So you're doing surgeries here in New York as well as down in Monmouth County.
Yeah, so I'm from, as you know, I'm from Monmouth County, so I grew up in Ocean, but the office is in Shrewsbury.
Mm-hmm.
I do a few cases a year out of the hospital, like the jaw surgery cases. I'll do in the hospital. But
Sure,
all
those are big cases,
Yeah,
right?
the
Yeah.
big cases. And also, we need hypotensive anesthesia, so it becomes they need an overnight stay. But all the aesthetic stuff is done in the office.
Got you.
Yeah. So we bring in a nurse anesthetist, and she does an amazing job. I actually met her at Jersey Shore.
Oh, nice.
And she took care of like all our trauma patients. I was like, if she can deal with trauma patients,
Sure.
Caller.
Sure.
she can deal with this.
100%.
Yeah, I have
she
another
can do-
caller when you're ready.
All right, cool. So pipe them through, Nat.
Hey,
Hey, how are you? Welcome to Close the Door Behind You. I'm Doc Jud, and this is Dr. Monolokakis. You have a question for Dr. Monolokakis?
I do. I'm really excited. I've always wanted to ask a doctor something without getting charged for it. So,
Shoot, buddy.
yeah. Can I get like a script for like Oxy?
I'm sure you can.
Oh, from us.
Oh,
want
you
us to
mean
call it
me?
in?
You
Yeah,
want
yeah.
me?
Oh,
Oh,
all right.
oh.
Yeah, I think that seems like a reasonable
Yeah,
request.
dude. Just shoot me a text, man. Give me your information. I'll send it out.
Really?
I get.
Is
it's-
it for like a hangnail or a pimple? Which
I don't know. I thought you just have to ask for it.
Oh, you just didn't. I just said yes. So.
Dude, this is bad. When I used to work in the emergency room, we used to have people come in all the time and like ask like crazy stuff like that. And like this one time, like this guy like came in or there was this lady and she had like come in from Argentina and she's like, yeah, I just need a refill on my Percocets
Yeah.
and on my Adderalls.
Right.
And I'm like, ma'am, I can't, obviously, like, I'm going to get in trouble if I could do that. I'm sorry. So she calls the administration and starts complaining. All right. The administration sends somebody from the C-suite, like an administrator, down to talk to me
Oh, God.
because they don't want a bad
Review.
survey review.
Right.
And she's like, can't you just like give her like, 3 days worth? I'm like, yeah,
Well,
basically, you would have to
So
do this
when-
stuff in order to keep
so
your
when
job.
the DEA comes and
Yeah.
they question me,
Yeah,
I'll just say my administrator said
Yeah.
give me 3 days worth.
yeah, crazy,
Well,
right?
So to help the caller at least, like, what should they be saying so that they can get an Oxy?
Oh, like what are
Prescription.
some of the
Ye-
key?
Yeah, like what does he have to say to you in a meeting of the doctor?
Well, he
That you have
definitely
stage 4
right.
terminal
He
cancer.
should definitely not ask for drugs.
Like,
that's-
specifically, that's already
that
a
would
flag.
be like no.
Okay, so
like-
you heard that, caller?
Like so, don't ask for it.
Yeah.
Okay, so
Okay.
so
You
how
might
do
want to
get it?
say you have metastatic cancer
Yeah,
all over your
exactly.
body, to your bones,
Right.
and you're in pain.
Yeah.
Can you help me? That would probably be
Yeah,
the
that would-
only
that would-
likely.
yeah.
They may check to indeed confirm that you do have metastatic cancer. That's
In that case,
metastasized to the
put your
bones.
head in the microwave with it on.
Yeah, I
and
mean,
you'll probably
or
get
you
it.
can self-mutilate yourself and say you got jumped and walk into a doctor's office and be like, "Dude, my ear's hanging off."
Yeah.
That works.
I
But
I
you
mean,
listen,
I
dude.
have
It's
all
not.
that,
Listen,
so
here's the
can
thing,
you, like,
dude. It's not
we just
free.
got the middleman, and
It's not free. You know, you gotta like put some skin in the game. And like when I mean
Yeah,
skin,
yeah.
like it means like an earlobe or an eyelid or maybe a lip
Or an organ.
or an organ.
Maybe
Like put an
donate an
organ.
organ.
Yeah, donate an organ. I mean that usually works. Yeah.
I
But
could
it-
just
but it's
pass
po-
the
it- yeah, it's
pass the
possible,
cost
dude.
on though to my customers. So.
Have you ever tried OxyContin before?
No, it just seems like the thing to do these days.
Yeah.
Really,
Yeah.
I heard fentanyl was like the cool thing now.
Yeah.
That's just that. That's
Isn't that's
well-
like a generic brand? I want like Sackler brand
Generic.
Oxy, please.
Dude, there's nothing generic about fentanyl, by the way.
well, there's
Pretty
like
generic
all
where I
those
live.
car fentanyl and all those
Generic
new
where I
ones
live.
that they're making in China and putting in all the heroin. It's that like
Yeah,
you know,
I just want to try it out. So I figure like
You know
I
what's
just kinda
crazy?
call
Dude?
you to ask.
Fentanyl is such a great medication. Like we use it in
For the
surgery.
OR.
Oh yeah, for the
Yeah.
OR. I mean, it's
Yep.
dangerous. You got to know what you're doing.
sure.
But it's such a great drug
Yeah.
for surgeries and.
It's a
just
bummer that it's been
that's-
tainted, like this and abused.
Because you tell when you're about to do surgery on someone, they start asking questions like, "What kind of medications are we going to
Right.
get?
What are you using for
Like,
sedation?
what are you going to get for sedation?" Right? And then
Yeah.
you're like, we do a little Versed, a little Valium, or we're going to use a little fentanyl. Oh no, not
Right, yeah,
fentanyl!
yeah.
I'm
Right.
like, you're not going to die on us.
Right,
We're
right.
giving you a little bit to control some of the discomfort.
Right.
So
like-
you could get fentanyl if you're going to the emergency room for like a main procedure.
It doesn't last that long,
Yeah,
actually.
it's
It's actually a
quick.
very
Yeah,
short-acting
yeah.
opioid. So we would use it for like procedures in the
Yeah.
emergency room. Like just give them like I don't know, 50
Yeah,
mics.
50 mics is great.
50 mics, 100 mics, nothing like that. I just had surgery on my eyeball. I had a pterygium scraped off, and so the guy gave me something and I'm like, "What is that?" And he's like, "I'm like, what are you giving me for anesthesia?" And he's like,
Ketamine.
"What do you want?" And
What
I
do
was
you
like, I
want?
didn't want to say anything. And I go, "Why don't you give me 100 milligrams of IV ketamine?" And he goes,
Eh.
"Sure."
Eh.
He gave it to me. Dude, perfect. I had
Perfect. It's a
I
great
was
drug.
great drug. I knew I was getting operated on. I had no
Knew your
anxiety.
shit.
I was I was like, cool, great. This is
IV
getting
ketamine.
fixed.
Yeah.
IV ketamine.
So that's what you should be gunning for, caller, is IV ketamine.
IV ketamine.
IV ketamine
Yeah.
with a K.
Yeah, bro, I'm
Not
a
a
little,
C.
I'm a little
Okay.
disappointed, dude. You came
So-
in not knowing your shit, dude. I thought you were gonna be a little bit more up to date with the drugs, dude. You went low. You lowballed, dude. You went for oxy. It's nothing, dude. It's child's play.
I'm just trying to fit in.
No, dude, that's child's play, dude. I'm a little. Call back next in about 10 minutes. Come back with some more, dude.
Okay, I'll come back with
You got it,
that I
bro.
can't.
Thank you, bro.
All right, caller.
Thanks,
Thanks
caller.
again.
Thanks for calling.
What's like the craziest thing that anybody's besides this guy? What's the craziest thing that anybody's ever asked of you? Like that's been like so like I don't know, audacious and so out of proportion.
To like what I do.
Well, yeah,
Or
like
just in- or
like you
what
know,
I
you meet
do.
like for example, like somebody like you meet at like I don't know, like a party or you just met and they call you and ask you for like some special kind of favor.
Bro, I had people ask me for testosterone, dude. Like,
Women?
no, men.
I'm just
Friends.
kidding.
Like friends.
Yeah.
Like, you know.
Can I have some testosterone?
No, you can't have fucking. I can't give you. I don't. You don't. You have testosterone.
I do. Yeah, I'm
You just
losing my
want more,
hair.
right,
Yeah,
right, you
yeah.
just want more. Yeah, the thing is like people think, oh, you're a doctor, you can write whatever. Bro, the pharmacies are like, bing. Every
Yeah.
time you write a script, they're like,
Yep.
what are you doing? This is you have no reason to be writing this stuff for
Right.
anyone. Right?
It's so difficult to write for anything these
Right.
days.
Right. So that was probably the most like kinda
Testosterone?
yeah, testosterone replacement. And, the dude's like 65. Yeah, he was about 65.
I mean,
Like,
it's
bro,
appropriate if you get blood work and stuff like that, but you can't just like write. I'll have people just say, "Oh, can you just write it for me?" First of
No,
all,
you
it's
can't,
a
dude.
controlled substance. You
Yeah.
can't,
Right.
and you have to basically check their, all
you
of their
gotta get
FSH,
a
their
lot,
LH,
yeah,
their
there's-
testosterone, their
And
thyroid
I,
panel.
and I
everything.
believe in all of that, dude. In
Mhm.
fact, I take a low dose
Me too.
testosterone. I think, 51, dude. Without it,
Yeah.
I'd be like in a tank, dude.
Yep. Yep.
I think my levels when I first started was like 200, dude.
That's low.
I was like 200, and I was
Yeah.
like, this is bullshit.
Right.
And yeah, so it's low dose, but it's it's
We're lucky to have
we're
it.
lucky to be able. It's again, it's also viewed differently now. It's not the testosterone
Right.
muscle head shit.
Right.
That's
We're not giving
it's
doses where you're gonna be
physiologic,
like
dude.
the
You're
size of
right.
Arnold Schwarzenegger.
Exactly.
Yeah.
Exactly. So it's all physiologic.
Can testosterone make me taller or no?
No.
Then what's
you
the
do
point?
surgeries
It
for
can
that?
it can make your dick bigger though, so maybe that's better.
Wow, that actually would be a great help
that's
to
great.
everyone.
Does
Yeah.
it make your dick better? I just
No.
thought it makes your balls shrink.
It does make your balls shrink, so relatively your dick
Wait,
gets
so
bigger.
relative to your balls.
Oh, yeah,
well,
that's a
not
good
gonna
point.
help either, dude. I got like a Tic Tac laying
Nah,
on 2
come on,
cashews.
dude. You're hung like a horse, dude.
Nah,
You're Greek.
yeah.
Come on, dude. You're
Come
Greek.
on, we all
Come
know.
on, bro.
We all know the Greek
Come on.
propaganda. We've seen the
No
Statue
way,
of
dude.
David.
No way.
Yeah.
All right, so we are getting to the time on the Close the Door Behind You podcast where we have something called the lightning round.
Awesome.
So the lightning round is a series of questions that we ask all of our guests, and I'm going to start it off with our first question for Dr. Manolis. Manoli,
Yes, sir.
you end up in an unfortunate situation, and you land yourself in jail. Who is your first phone call?
My wife.
Even if it was like with Ladies of the Night.
Dude. Doesn't matter. She's going to find out anyway, so I might as well go to her. She's my rock, dude.
Yeah.
Period.
So maybe she's in the jail with you, though.
She might be.
Yeah.
Most likely she would be in the jail with me, but if she wasn't, I'm calling her.
If she was in the jail with you, you both did something, who would you guys call collectively?
Oof. Call my attorney, dude.
Tiffany Weiner.
Yeah, baby.
Tiffany Weiner's getting called.
Yeah, so get her on the line. Get her on the line.
She's not even a
She's
not
not
even a
e-
criminal,
doesn't
but she
matter,
will get in
dude.
there
Doesn't
and
matter.
she will be your criminal
she'll be
attorney.
a criminal attorney afterwards. Absolutely.
Yeah.
She's the best.
She rocks.
Okay, next question. I mean, what do you think happens to you after you die?
Oh shit, man, that's a loaded question. I'm Greek Orthodox. We believe in, going to the promised land. I probably think there's a little bit of reincarnation.
Mhm.
I do. I think their energy is, from a religious standpoint, we go into another realm, right?
Mhm.
But from just like a science, scientific brain, there's energy that we have. We're made up of energy, and you don't kill. Energy doesn't get killed; it just transforms. So the energy goes somewhere. Where it goes, who the fuck knows, dude?
Yeah.
But I'm not afraid of it. I can tell you that.
Yeah.
I'm
You're not afraid of death at all.
No, I mean,
Like if I killed you right now, you'd
well,
be,
you could, and it'd be sad for the people left behind. But I mean, I'd be dead, right?
Yeah.
And hopefully, I'd be reincarnated as someone to come back and get the fuck out of you, but take care of you.
Nah.
What would you want to come back as?
Oh, dude.
If you were
That's a-
if
that's a
it
really
wasn't
good
if you couldn't come back as,
As
a
a
human,
human?
yeah,
I
you
would-
have to come back as an animal. Who'd you come back as?
I want to come back as a pit bull
ooh.
that then my wife would adopt
Ah,
because I know I'd be taken care of, dude.
Oh.
I've said this forever. I want to come back as her pit bull.
That's pretty cool.
Do you
And then
guys have
everyone
a
would be
dog?
like, "Don't worry, he's
We had
friendly."
what?
do you have a dog?
We had one and she passed. So
Gotcha. But in
her
other words,
name's
she was
Lila.
very kind
Dude, are
to
you
your
kidding
dog.
me? Dude, she was like
Probably takes better care of the dog than you.
totally.
Yeah. That's
She's
like
a-
me and my wife. Yeah.
She knows it. She
Yeah.
wouldn't. Yeah.
She like when she leaves to go somewhere, she's like, "Bye, I love you,
Yeah,
dog."
yeah,
And I'm like, "Hey,
yeah.
I'm right here." What about me?
Yeah.
Yeah.
Okay, I got a question for you. So, if you could invite anybody to dinner, live or dead,
Woo.
who would it be? You can pick
Damn.
anybody from history or anybody who you just think is super cool that's currently alive, and you get to have dinner with that person.
Dude, that is a loaded question, dude. Holy shit.
That's why it's the lightning
yeah,
round.
Yeah. Whew. Dead or alive in history. Fuck, dude. I mean, I could go with like George Washington. He'd be fucking pretty interesting to
George
talk to.
Washington. That's an interesting choice.
Yeah.
Interesting to talk to.
His
him.
slaves could cook for you.
Well,
Yeah, I heard he
Yeah.
had slave teeth.
Did he? What does that mean?
we
like
he had
teeth
wood
he
teeth.
doesn't
He had wood
pay?
teeth.
I-
Instead of wooden teeth.
Yeah.
Oh, they were slave teeth.
Yeah.
They had
Oh, they were
combination.
other people's teeth?
Yeah.
Yo, that's
Oh, that is-
crazy. You would
that's-
have dinner with that guy?
Yeah.
He would fix his teeth.
So
He'd
yeah,
be
there
like,
you
"Look,
go.
I'm gonna get you.
Surgery, yeah.
I'm gonna
Hold
get
on,
you
let
booked
me-
for the OR in the morning. Let me make some arrangements for you."
Yeah, and GW sounds like a pretty good. I mean, Abe Link, like I
He would probably pick you as if he ever got
Right,
asked that
right,
same question.
right,
Be
right.
like, I would like to go forward 300 years and have operate. I'd like
Yeah.
to meet Dr.
Right.
Manolis in the operating
Right.
room and get these teeth fixed.
I know. I think presidents are pretty cool to meet. You know, Abe Lincoln would be really freaking cool to meet.
Yeah.
I don't know, man. I just think it's such a fucking powerful, weird fucking position to be in, dude.
Right. A lot of pressure, too.
You know, they all age like exponentially, right?
Mhm.
Remember Obama? Obama came in looking like a little young kid.
Yeah.
8 years later, dude, he looked like he aged 20 years.
Yeah.
It's wild.
Yeah.
The stress is crazy.
Yeah, especially like, 40 to 50, like you don't see too much of a change in like appearance
Right.
of regular people.
Yeah.
Yeah. That's a good point.
So
Uh,
that's interesting. They're interesting. Hey, who the fuck wants to be a president, too, dude?
So
Anyway,
so
sorry.
what's one life hack that you know that more people should know about?
One life hack.
Yeah,
that
like
I
any
know.
hack that you know, like I always make sure to put a grocery bag in my pocket when I go to the grocery store. Like it could be
Thank you. I'm
something
gonna use
that
that
minor.
from now. Oof, man. My life hack. Shit. I don't know, dude. Like you need like 10 minutes to yourself every day,
Mhm.
whether it's the morning or the afternoon or
Yeah,
right
speak
before
closer
bed.
to the mic. if you
Whether
can.
it's morning or night, you need 10 minutes to yourself. You know, I try to do it in the morning. Like that's my favorite time to do it because it's early and it's quiet, and I haven't been like infected with other shit in my head yet. So
Mhm.
10 minutes just to kind of like clear everything, and that's usually when I'm taking a shit on the
Yeah.
toilet. So yeah, so get into that mode while you're shitting.
Right.
Okay.
I respect
You
that.
respect that?
Yeah, I mean, I
And
really
by
have
the
to
way,
say-
if you're not shitting, figure that out because that's the true life hack. Making sure your gut is working correctly, because everything else will work correctly.
really, Well,
Sure.
what are some things that you should do to ensure good gut health?
Well, you can't eat shit. Like you got to eat real good food. And Doc will tell you, you got to have some vegetables. You got to have things that are gonna process the foods. Magnesium is a great medication or a supplement. I take magnesium right before I go to bed, and then in the morning, dude, it's like fireworks, dude.
Yeah,
Yeah, it's good.
it just
stuff.
keeps you energized.
No, it keeps the gut. You know, helps the gut move the stuff through.
You take mag citrate?
Yeah, citrate.
Interesting.
Yeah. And then I also mix it with mag threonate, L-threonate,
Oh,
and that
that's
helps
to
me
go to
sleep.
sleep.
Yeah, so
Interesting. I heard about that.
I love to sleep. It's the best for sleep, but the citrate's really good to
Very cool.
So all that is right before you go to bed.
That's before I go to bed. And when I wake up in the morning, I have a whole other slew of supplements I take: creatine, fish oils, vitamin C, zinc, CoQ10. What else do I take? I take a bunch of protein, amino acids, because I like to take that stuff before I work out. I don't eat before I work out, so
Mhm.
I do like I do a fasting workout.
Mm-hmm.
But that stuff gives me a little bit of energy. So.
But taking all those supplements on an empty stomach doesn't mess up your stomach.
Well, I haven't really had problems with that yet, but if something changes.
Yeah, for me, if I take vitamins on an empty stomach, I throw up.
Yeah, I get
doesn't-
nauseous.
Yeah, I don't get that. I don't
Hmm.
get that. And then a good cup of coffee, man.
Yeah.
I think you need not right away. You gotta have that. You gotta drink stuff first. You gotta drink water.
Mm-hmm.
First.
before you have coffee.
Yeah, you kind of do, dude. It's
Do
Do you
better
drink
for
like
you.
energy drinks before you
No,
go work out?
I don't.
Really?
No,
you
I
just
don't.
have enough energy to just go out there and do that?
Yeah, so the amino acids I take is like equivalent to like 40 grams of protein,
Yeah.
and then I would say the creatine is not really. It's not like a pre-workout drink.
Right.
Then I have a cup of coffee and then I go, man.
Interesting.
So I was reading this thing that was saying that like kids are now opting out of medical school and they're trying to be PAs more, or
Interesting.
they're like it's just like a hard time for people to like recruit doctors and everything because there's just so much workload and like years of not really getting paid well until you get paid really well.
Right.
Like what do you think is like your interpretation of that landscape, and like why should some people like pursue being a doctor, and like what made it worth it for you?
Well, first and foremost, dude, like you don't become a doctor for the money. That's bullshit. Like because there's no amount of money that is going to make you happy if you're not happy doing whatever the hell it is you're doing. So if you don't love taking care of people and offering your knowledge and your services, yeah, you don't want to do it for free. That makes no sense. You don't want to like work and slave and not get paid, but the money isn't going to make you happy. So finding whatever niche that is in medicine, if you want to help people, some people are radiologists. They don't want to really deal with patients per se, like face to face, but they really like having this knowledge and helping the patient, but not necessarily face to face. And then there's all different specialties. So I think you find your niche. I think if you want to help people, that has to be the number one thing. You got to want to help people. And, the money stuff kind of like comes and, naturally. It shouldn't be the primary source of why you get into anything. And I think, and I'm maybe not talking right, but maybe the younger generation wants that quick buck. They want to make money while they sleep. I want to make money when I sleep, but it's not that easy.
Right.
So,
What's something? I got a question for you.
That's my perspective.
What's something that if you had all the time in the world, like what's a skill that you don't have right now, but if you had all of the resources afforded to you, meaning time, the best people to teach you, what's something that you would have loved to learn how to do?
Dude, I should have learned how to play all the musical instruments I could have. Guitar, piano, fucking violin, everything, dude. I wish I didn't have that. Those things weren't important to me when I was growing up.
Yeah.
But now, when I'm older,
Right.
I'm like, damn, I could have just been jamming out, dude.
Yeah.
And just enjoying like downtime and stuff like that. So I like that stuff. I can draw. I don't really, and I haven't honed that in. But that's another thing I wish I kind of like focus in on drawing.
Yeah, I draw, I paint, but
that's cool.
It's hard to find the time. Well,
Isn't it therapeutic?
Yeah, it's super
like you
therapeutic.
feel great when you do it.
And it's almost like a meditation,
Yeah,
right? Like
sure.
because you're kind of like hyper focused
Yeah.
on something like that, turning your brain off,
Yeah.
and I know I love it, but I don't get to do it as much.
Why do you
But-
think Bob Ross used to just sit there and paint? Like,
Well, he was high. He was definitely smoking weed, Bob Ross. Like, there's no way Bob Ross wasn't smoking weed.
Yeah, he was.
Yeah. Wait. So, actually, good question. Unless you feel uncomfortable asking.
I don't feel.
But like, what's your perspective on nicotine? I know you touched on it before, but like, now that people are zinning and stuff like that, it's more popular.
I think everything in moderation is great. I use not Zyn. I use Rogue. I mean, I like and I'm not paid by them, dude. It's just the one I like. Mango is my flavor, and I think I feel sharper when I'm kind of taking it. I can sometimes, there's so many things going on in a day, and you're kind of like you feel like you're being pulled in many different directions, especially when you're running a business. So sometimes I take a Rogue, and it's like, boom, I get down to like what I need to do, and I think that's really helpful for me. But nicotine, it is like you can get addicted to it with 100%. But there are some good nootropic side effects of it, and I think it's great. But it's not smoking. It's not causing cancer. It's not these types of like, taking tobacco. It's not tobacco. It's nicotine. Right, so I think people get that a little confused.
Right, the delivery system is safe.
System completely different.
So what about recreational marijuana use?
Man, I don't have a problem with marijuana use, dude. It's to each their own. I mean, some people are completely against it. Do I believe it's a gateway drug? I don't. I think that's all bullshit. I think if you want to do drugs, you do drugs. Again, moderation, dude. If you want to smoke a joint, go for it. You know, I don't judge. I don't care. You know, if you're going to be stoned all day, then I think your brain cells are fried. You know,
Yeah.
I mean, I have friends who do smoke all day,
Right.
and you know, you can kind of tell.
I think the thing that we don't really recognize is the reason why people do drugs. So it's not that it's not the drugs,
Right.
it's what's going on in their life, what happened
Right.
to them to make them feel empty, and they take this substance and all of a
Right.
sudden now they feel okay. That's like the bigger question,
Yeah.
and then people, I think society's just completely like run over that, and then they're just like, you're a bad person because you're on drugs, but
Right.
really there's a reason, and so they got to fix that reason, you know?
Yeah, and I think that people have a harder time facing whatever demons those are.
Right.
You know, that's a hard thing to do. Like you're talking about what's the reason they're taking something to alter their mental status. That's a really difficult, like, soul searching thing to figure out. It could be something that, you know, you don't really want to like confess to, or your you know, your parents, you know, did something to you, or whatever the reason. Again, I think it's, you know, it's just one of those. I think the weed these like now is worse than what it was. You know, 20
Because it's
years.
too
I mean,
strong.
That this stuff will knock out a horse.
Yeah. No, it's crazy.
You know, it's you know, the edibles too. The edibles are
The edibles
like
are
that
out of
stuff. I don't
control.
really like.
Yeah.
But I think the mushrooms I probably would recommend are better. You know, than the marijuana for instance.
Oh, like microdosing
Yeah,
mushrooms.
I think that people are really happier on those. They're like little attitude adjusters, or make you happy without making you all fucked up. So, so
Yeah, that's a
works.
valid point. Oh, cool.
Have you ever? I got a question for you. What is? What's your favorite? I'm gonna lighten it up. What's like your favorite food?
Dude, my favorite food is sushi.
Oh, really?
Yeah, Japanese food.
No kidding.
I eat that every day.
Nice.
Yeah,
We happen to have
I love
Japanese
Italian, yeah.
significant others.
yeah.
Yeah,
You,
we'll have.
oh, both of you.
Yeah.
Oh, very cool.
That's
same,
actually how
same
we met.
woman. We share one
Fucked up, dude.
woman.
Yeah, so yeah, we'll have to. I didn't
Dude, I
realize that.
love. So I took karate when I was young, 5 years old to like 16, and I got my black belt when I was just before my 10th birthday.
Okay.
And so I was really like indoctrinated into like the Japanese culture from karate, and I've been like fascinated by just the culture, and you know, they're just like, and going there was just kind of like amazing, seeing, you know, just the utmost. There's just respect, you know, this whole respect thing that they have over there. It's
Well,
like-
that's your Greek side, right? Because Greek culture is a lot about respect too.
It is, but you know, the Japanese are different, man.
Yeah,
It's,
yeah.
You know, Greeks are like hugging you and kissing. Japanese are like, you know, very like they're within.
Yeah.
You know? And that's amazing. Like, I don't know. I think it's pretty cool.
Yeah, no. I used to live there.
Japan? Or?
Yeah.
Oh yeah. Nice.
So I
Like Tokyo or?
yeah, in Tokyo. Yeah, so it was cool. But my wife is from Yamanashi, which is like a countryside where Mount Fuji is.
Right. Very
Yeah.
cool.
But so sushi at Izakaya Juraku is pretty good.
Well, check it out. My wife. I'm sure my wife's been there.
Yeah, maybe.
She used to live in. How long has this place been here?
Probably like 7 years.
Oh,
or so.
okay. She
Yeah.
used to live on in
8
East
years.
Village. So
I'm trying to think of my
many years
favorite
ago.
thing to eat there. I like so he makes these they're French fries and he puts wasabi powder in them.
Oh, God.
So good.
Yeah.
Maybe
pretty
not the
good.
best thing for you, but it's delicious.
I know, man. My LDLs are a little high, dude. I gotta like,
Same.
Fuck.
But I don't want to go on the medications, right? Like
No.
Lipitor and stuff. That they say it's not good to
Dude,
take
it's
it.
so weird. Like, you know, I get this. You know, I speak to my doctor all the time. He's like, I know you don't want to take it, and I'm like, I'm researching. I'm like, you know, cholesterol's a good thing, dude. Like,
It's a
we need
precursor to
cholesterol.
testosterone.
To stop for
Yep.
all our hormones.
Yeah.
Our brain, all our cells are made out of cholesterol. So it's like you take these medications and you're like killing your cholesterol. I don't know, man. It's like before Lipitors of the world came out, like normal cholesterol was like 220 or something like that. Like that. Now
Oh,
it's, like,
higher, and they lowered
higher,
the bar.
Yeah.
Huh.
Well, you got a medication, and I'm not trying to play like some sort of like, you know, like the pharmaceutical companies are, you know, trying to like make money or anything. You know, I think certain people need to be on it, but diet is number one, dude. You got to work out, you got to eat right, drop things like that, and then if it doesn't go down, there's other things. You can
And so I was watching one of your. By the way, I forgot to we've been talking so much because you're such an interesting guy. We forgot to mention that you have a TV show called Behind the Mask.
behind the beard.
Behind the
Yeah,
beard,
yeah,
excuse me. Behind the beard. And
Behind your beard?
Well, yeah, kind of.
he has, if you haven't noticed, a beard. But I watched
I just
one
got
episode.
trimmed for you fuckers today too, man.
Thank you,
Yeah,
dude.
you're
You look
welcome.
great,
Looks
buddy.
really
Thank you for
trim.
doing that.
Thank you. Usually
and-
like this. Dude.
Oh, nice.
And so I saw in one episode that you're really big you're big into working out.
Yeah, 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 man. I'll tell you, I've always worked out. I played sports when I was younger. I was always physically fit. Went to school. I got a little bit out of control. When you're in residency, you start
Can't
to
work out.
You start to expand,
Yeah.
and because you're wearing scrubs that are loose, you don't realize
Right.
like you're getting bigger. And then you go to put a suit on, and like the shit doesn't close,
Yeah.
and you're like, holy shit! Like I'm 30 years old, and I'm fucking beast, right? I'm just a big slob.
Mhm.
So I got out. I started working out again, and it's really important to keep. It's really the couple things that make me like level-headed is working out in the morning. If I miss a workout, I feel like I don't know. I feel off, dude.
Every day you're working out?
Yeah, I work out pretty much.
Good
Like
for you.
No rest days?
No, I don't work on the weekends.
Oh, okay.
5 days a week though.
Wow.
It's and it's different stuff, But yeah, I like to work out, and it used to be just 3 days a week, and then when my, I don't know if you know this or not, but I had a nephew that passed. He passed away.
Oh, sorry to hear that.
2014.
I heard about
Yeah, he
it, sorry.
OD'd, man. He fucking, smart kid, but he just got bit by the bug, and that was it. And it was just his 11 years on October 31st, on the 31st. So that was a little bit of that kind of like, I was like, I wanted to, I knew he was going through this, and we were going through it as a family, and I think personally, I may have felt like I failed, like trying to help or whatever. And so I used to work out like 3 days a week, and then I just said, fuck it, dude. I'm going to, I felt like I needed to do some sort of like pain to myself.
Interesting.
And I went really deep into like, dude, I would wake up at 4:30 in the morning before the operating room and work out for an hour.
Wow.
Then go to work. And I got like a little bit maniacal, and actually the tattoo is really kind of like,
Oh, cool.
you know what Kaliandamosi means?
No, I don't know.
Kaliandamosi means I'll meet you in heaven. Like it's
Oh.
night. It's gonna be like good meetings for you, like in the future. Like we're gonna
Oh.
meet in the future. So that's how this started, and then from there it kind of grew to all of this.
Cool.
But yeah, man. So I don't know how I got to this point. Working out, yes.
So
So
you-
I love working out, dude. It keeps
Yeah.
me. It keeps me like.
But that kind of
Focus.
so when you went through a really dark time, it seems like that kind of helped you at least treat your.
It was my
the
way
difficult-
of my coping
Yeah.
mechanism.
Yeah.
But it's
every-
interesting. You
everyone
kind of
lo-
like punishing yourself with like DOMs, right? Like, for that sort of. It's almost like a, what's it when you flame
Self-deprecating or self. self-
when the guy in the in the Da Vinci Code.
Yeah, or when they wear the leg thing, and they're like tightening the belt on the
Yeah.
leg to cut into the. Yeah, I mean, I guess it was a form of that.
Yeah, that's interesting.
It was.
but it's a positive one.
Yeah, well, absolutely.
Yeah.
Like most people wouldn't take that in a positive way, but like you had the emotional maturity to be like, I'll channel this in a positive way.
I don't know if it was emotional maturity, or maybe I just couldn't cope with it any other way. I
Mhm.
just felt like I needed to like do something, dude.
Mhm.
And it was pain. It was. I mean, it's still painful. I still miss him, but it's yeah, man. He was fucking about almost 25 years old, dude. He was like 2 weeks away. So his birthday's right now, like November 14th.
Oh,
so he
wow.
died on the 31st. Fucking 11/14 is his birthday. So anyway, not to bring the mood down, but
No,
so
you're
that's
good, man.
that's the working out kind of thing. And then also it's kind of like, I need to mentally make things really fucking hard for me, like
Mhm.
working out wise, and it makes all the other shit I do seem not as difficult or painful. So like in my brain, I want my hardest part of the day to be the first
thing in
thing
the
I do
morning.
in the morning. If
Mm.
that
Makes
makes any
sense.
fucking sense.
So everything
Yeah.
else is kind of cruise control.
Yeah. Because shit happens. But if
Mhm.
I'm already if I already like killed myself and put myself into the ground,
Mm.
everything else seems pretty good, dude.
Yeah, is it you ever do surgery and you got like DOMs so bad that you're like trying to lift your hand up?
No, I mean, in the past, I've had some times where my wrist, my grip would be like tired and stuff like that. But I try not to do too much of like heavy weights anymore, dude.
Yeah. The last thing I want is my doctor to be like, "Oh man, just got a great pump. I could barely lift my arms. You ready to go under the knife?"
But they do know, they do. So the staff knows, and the patients kind of know because I'm walking in with my workout clothes. If I don't work out in the morning, the staff's like, "Oh fuck, you didn't work out today."
No.
And
So
they know, dude. I get like
your mood basically.
dude. I'm moody.
Wow.
I'm moody because stupid shit bothers me. When I work out, they're coming. Oh, Dr. M, the so and so patient canceled. I'm like, all right, that sucks. If I didn't work out, what the fuck did you guys do? Why did they cancel? Why did you push them away or something?
Yeah.
I'm an ass.
Wow, that's funny.
So talking about your surgery and talking about the show, Behind the Beard, like so where can people see that show? What platforms? Where else can people find you?
Right. So that's so YouTube is where Behind the Beard is. We did two seasons. We did season 1, season 2. It's just kind of like the behind the scenes of like my practice, myself, my wife a little bit, and just kind of like getting hence Behind the Beard. You can also find us on Instagram at Dr. Manolis. TikTok, I think we call the Bearded Surgeon on TikTok.
Nice.
I don't even know, dude. There's so many different.
That's
things.
a good name to have.
The Bearded Surgeon.
Yeah,
that's one of my.
that's pretty
That's one of
dope.
my like little hashtag things.
Got that early.
Yeah. And then man, I practice out of Manhattan. I'm on 9th and between University and 5th. It's a small little office there Mondays and Fridays. And then we're in Shrewsbury, New Jersey, man.
Do you feel like you have to do that now as a doctor? Like have that online presence?
Dude,
like, what kind of motivates you?
Especially in aesthetics, where it's basically like what motivated me to do Behind the Beard was there was so much like shit going on that people were putting on. I was like, this is so boring. Like I was bored. Like I looked at stuff like even content now. It's like boring. It's like, what if we got like the style of MTV Cribs? Like we filmed it like MTV Cribs, that type of like vision, but it was just like shit that was happening in the office. Surgeries. You come into the operating room, see some weird shit, see some post-ops. Then we were having a conversation. It was just more about being real than kind of like putting something out there it wasn't really like advertising. It was more like, let's just have fun with it. Kind of like having a podcast. Like, I'm sure you like doing this, right? It's just fun for you guys.
Yeah, sometimes our guests suck. Like,
I
they're
get it. Like
bearded
me, I
doctor.
get it. I know, like the fucking,
I
like
got
boring
it.
fucking
Yeah.
dummy Debbie Downer over here.
Nah,
No,
you're
I
good.
mean, there's like, so it's kind of more like a fun thing to do. But yeah,
It's an artistic outlet for you.
Yeah, it was.
Cool.
It was just another way of like, kind of like.
But you feel like
expressing myself.
estheticians like need to, or like the people kind of in your line of work kind of
Dude.
need to do this sort of
You
thing.
have to, man. It's unfortunately, but that's just part of the game now. you know?
Yeah.
Yeah, I mean, it used to be just having your number in the yellow pages. That's not working. And having Instagram is like free, so you have to be on that. TikTok is one of those other things, and you got to put yourself out there. Unfortunately, or people may not know you're there.
Mm-hmm.
Yeah, and there's a lot of people out there doing what I do, so you kind of have to be.
Do people
lot of
reach out to
competition.
you through these channels and
Yeah,
say, "Hey"?
yeah. I try not to answer too much on those channels because, like, you don't really want to give medical advice. Like,
Right.
it's one thing if you're talking with a friend and you're having like that type of stuff, but the second someone's reaching out to you in your professional role and you respond like, "Hey, this is what I think you should do," you kind of created some sort of
Legally,
therapeutic, right.
legally, there
Right.
now is a relationship, even if you were just
relationships.
the second you
Yeah.
contact them,
Yeah.
so,
So
you
you
could
kinda
be
have
held
to be like-
accountable for anything that goes
Mhm.
bad with
Right.
them, even if they did something that you didn't recommend.
Right.
There is a duty.
Yeah.
You know.
Mm.
So it's kind of weird stuff like that you don't really think of, and they don't like people contacting us. They have no clue what
Mhm.
They just want to. They have a question. They want to answer a question,
Right.
and it's kind of so easy to do that these days with a DM that they don't think twice about it. So I try
Right.
to push that off to the staff. But yeah, they contact.
So,
You kind of want them to contact.
yeah, to book you.
You
yeah.
do, but you gotta like funnel them somehow.
Yeah.
and that's the.
Well,
key.
actually, there's really easy. I could tell you after this, like how you can turn that into a funneling thing. But,
Yeah.
yeah. So, but yeah, cool. Any other questions? Oh wait, do you have any hot takes that people like are always like, oh come on, Manolis, you're such an asshole. Like, why do you think that?
What do you mean hot takes?
You know, like I think like hot women don't actually like Japanese anime. Like that's my hot take. Like I think it's not true. Like you know they're just using it for attention. Like do you have anything like that?
Not really, dude.
It's like a generational question.
Yeah, dude, I'm too old. I don't have hot takes, dude.
No strong opinions on anything that goes against the grain.
Oh fuck, dude. I don't know. I can't think of anything. I'm sure I got fucked up opinions about a lot of different things. Just can't really think of one right now.
When you do surgery, do you have
Yeah.
to wear those like Chipotle beard masks?
No, I don't wear that, but I do end up wearing like minimum of two masks.
Mhm.
So one that kind of comes up here, and then another one that cups the beard.
Yeah.
I've had some masks made for me
Mm.
that were longer with like a little bit like almost like a jock strap for my beard.
Like a pandemic
Yeah,
from
yeah,
1800s,
yeah,
like the
yeah,
long
right,
crow
right,
neck
right,
thing
yeah.
that we actually have in our on our background. Some of
In
those.
the old one.
Yeah. So, but that wasn't comfortable. So I resorted to like the double mask technique,
Mhm.
and yeah, it's fine. But cool.
Nice.
All right, so that's going to wrap up our episode of Close the Door Behind You with special guest Dr. Manolis Monolokakis. We'll see you next time.
Thank you guys.
Thank
That was
you.
awesome, man.